As the sun dips below the horizon, a tiny creature stirs. With a high-pitched buzz, the mosquito takes flight, its shadow dancing in the twilight. These seemingly insignificant insects, often dismissed as mere pests, harbor a dangerous secret. They are carriers of deadly diseases, capable of unleashing silent epidemics that can cripple communities and claim countless lives. Among the most formidable foes in their arsenal are dengue and malaria. These two mosquito-borne illnesses cast a long shadow over vast swaths of our planet, affecting millions each year. Understanding the differences and similarities between these diseases is crucial in our fight against them. Dengue, caused by the dengue virus, is transmitted primarily by the Aedes mosquito. It manifests with symptoms such as high fever, severe headache, pain behind the eyes, joint and muscle pain, rash, and mild bleeding. Malaria, on the other hand, is caused by Plasmodium parasites, which are transmitted through the bites of infected Anopheles mosquitoes. Its symptoms include fever, chills, and flu-like illness. If not treated promptly, malaria can cause severe complications and even death. Treatment for these diseases varies significantly. Dengue has no specific antiviral treatment. Care is supportive, focusing on relieving symptoms. Malaria, however, can be treated with anti-malarial medications which are effective if administered early. Prevention strategies for both diseases include mosquito control measures such as eliminating standing water, using insect repellent, and sleeping under mosquito nets. Vaccines are also being developed and deployed in some regions to combat these diseases. By arming ourselves with knowledge, we can better protect ourselves and our communities from these silent but very real threats. Through education, prevention, and timely treatment, we can reduce the impact of these diseases and work towards a healthier future for all. Dengue fever, often referred to as breakbone fever due to the intense joint and muscle pain it inflicts, is a viral infection. It is caused by the dengue virus, a member of the flavivirus genus. This virus exists in 4 distinct serotypes, meaning a person can be infected with dengue up to 4 times in their lifetime. Dengue is prevalent in tropical and subtropical regions around the world, particularly in urban and semi-urban areas. Its impact is significant, with an estimated 400 million infections occurring annually. Malaria, unlike dengue, is not caused by a virus but by a parasite. This parasite, known as Plasmodium, is a single-celled organism that infects humans through the bite of infected mosquitoes. 5 species of Plasmodium are known to cause malaria in humans, with Plasmodium falciparum being the most deadly. Like dengue, malaria thrives in warm climates, particularly in sub-Saharan Africa and Southeast Asia. It is a leading cause of death in many developing countries, claiming the lives of over 400,000 people each year, many of whom are young children. Both dengue and malaria share a common mode of transmission, the bite of infected female mosquitoes. These mosquitoes, primarily belonging to the Aedes and Anopheles genera respectively, act as vectors, carrying the disease-causing agents from person to person. When an infected mosquito bites a human, it injects saliva containing the virus or parasite into the bloodstream. The virus or parasite then multiplies within the body, leading to the onset of the disease. It is important to note that neither dengue nor malaria can be spread directly from person to person. Section 5. Dengue versus malaria, a tale of 2 diseases. While dengue and malaria share a common vector and some overlapping geographical distribution, there are key differences between these 2 diseases. Both are transmitted by mosquitoes, but the specific types of mosquitoes differ. Dengue is primarily spread by the Aedes mosquito, which is active during the day, while malaria is transmitted by the Anopheles mosquito, which tends to bite during the night. Understanding these differences is essential for accurate diagnosis and effective treatment. Misdiagnosis can lead to inappropriate treatment, which can be dangerous. For instance, treating a dengue patient with anti-malarial drugs would be ineffective and vice versa. Dengue is caused by a virus, specifically the dengue virus, which has 4 distinct serotypes. Malaria, on the other hand, is caused by a parasite, with Plasmodium falciparum being the most deadly among the 5 species that infect humans. This fundamental difference dictates the course of the illness and the approach to treatment. Antiviral medications are being researched for dengue, but supportive care remains the mainstay. For malaria, a range of anti-malarial drugs are available, and treatment often depends on the specific Plasmodium species and the patient's condition. Dengue typically presents with a rapid onset of high fever, severe headache, and joint pain. These symptoms can be debilitating and are sometimes referred to as breakbone fever due to the intense pain. Malaria, on the other hand, often manifests with cyclical fever episodes, chills, sweats, and flu-like symptoms. These fever cycles correspond to the life cycle of the malaria parasite in the blood, leading to periodic spikes in symptoms. Another crucial difference lies in the potential for long-term complications. Both diseases can be severe, but the nature of their complications varies. While most dengue infections resolve within a few weeks, severe dengue can lead to life-threatening complications such as dengue hemorrhagic fever and dengue shock syndrome. These conditions require immediate medical attention and can be fatal if not treated promptly. Malaria, particularly caused by Plasmodium falciparum, can also lead to severe complications including cerebral malaria, severe anemia, and organ failure. Cerebral malaria affects the brain and can cause seizures, coma, and even death. Severe anemia results from the destruction of red blood cells, and organ failure can occur if the infection is not treated in time. Section 6. Symptoms. Recognizing the enemy within. Recognizing the symptoms of dengue and malaria is crucial for prompt medical attention and a better chance of recovery. Both diseases share some common symptoms, such as fever, headache, and muscle pain, which can make diagnosis challenging. Dengue fever typically presents with a sudden onset of high fever, severe headache, pain behind the eyes, joint and muscle pain, nausea, vomiting, and skin rash. Some individuals may also experience bleeding gums or nosebleeds. Malaria, on the other hand, often manifests with recurrent cycles of fever, chills, and sweating. Other symptoms include headache, muscle pain, fatigue, nausea, vomiting, and diarrhea. In severe cases, malaria can cause jaundice, seizures, coma, and even death. Section 7. Treatments. Battling the invisible foe. Treatment for dengue and malaria focuses on relieving symptoms and managing complications. There is no specific antiviral treatment for dengue fever. Treatment primarily involves rest, hydration, and over-the-counter pain relievers to manage fever and pain. In severe cases, hospitalization may be necessary for intravenous fluids and electrolyte management. Malaria, on the other hand, is treated with anti-malarial medications. The choice of medication depends on the species of Plasmodium causing the infection, the severity of the disease, and the drug resistance patterns in the area. Prompt treatment with appropriate anti-malarial drugs is crucial to prevent complications and reduce the risk of death. Section 8. Prevention. Our best defense. Prevention is key in the fight against dengue and malaria. Since both diseases are spread by mosquitoes, mosquito control measures play a vital role in reducing transmission. These measures include eliminating mosquito breeding sites such as stagnant water in containers, old tires, and clogged gutters, using mosquito repellents containing DEET or picaridin, wearing long-sleeve shirts and pants, and sleeping under insecticide-treated mosquito nets can also significantly reduce the risk of mosquito bites. For travelers visiting areas where dengue or malaria is endemic, consulting a healthcare professional about preventive medications, such as anti-malarial drugs, is essential. Vaccinations are also available for certain types of dengue fever. Section 9. A call to action protecting ourselves and our communities. Dengue and malaria are serious public health concerns that demand our attention and action. These diseases, transmitted by mosquitoes, can cause severe illness and even death if not properly managed. It's essential to recognize the symptoms early and seek medical help promptly. By understanding the differences and similarities between these diseases, we can make informed decisions to protect ourselves and our communities. Education and awareness are key components in this fight. Knowing how these diseases spread and what measures can be taken to prevent them is crucial. Simple yet effective measures, such as eliminating mosquito breeding sites, can have a significant impact. Mosquitoes lay their eggs in stagnant water, so it's important to regularly check and clean areas where water can collect, such as flower pots, gutters, and old tires. And using personal protection measures like applying mosquito repellent, wearing long-sleeved clothing, and setting up mosquito nets around sleeping areas can further reduce the risk of mosquito bites. These actions, combined with community efforts, can significantly reduce the risk of infection. It's not just about individual protection, it's about collective responsibility. Supporting public health initiatives aimed at mosquito control is also crucial. These initiatives often include spraying insecticides, distributing information, and organizing community cleanup events to eliminate breeding sites. And disease surveillance is also crucial in the fight against these mosquito-borne illnesses. Monitoring and tracking the spread of these diseases help health officials respond more effectively and prevent outbreaks. Let us work together to create a world free from the threat of dengue and malaria, where everyone can live healthy and productive lives. Our collective efforts can make a significant difference. Imagine a future where children can play safely outdoors, families can enjoy their time together without fear, and communities can thrive in a healthy environment. Remember, prevention is not just better than cure, it is our best defense. By taking proactive steps and working together, we can protect ourselves and our communities from these devastating diseases.